Hey guys, welcome back to the Stretch Mobility Coaching Podcast. And today I am excited to share hopefully something that many of you have not had to experience, but I want to set you up for success when you do have to go into the healthcare system. Sort of what some of the decoding and the language that providers use may make you feel like you're not being heard or listened to, okay? Because healthcare providers are trained in a specific type of documentation, and it is built around the insurance reimbursement, not necessarily around the customer, because you've got to know that if you want your insurance to pay for this, then your provider is talking to the insurance company for payment. Okay. Even though you're receiving the service, you're coming in with a problem, but the person who's paying for that problem is going to be the person the provider is documenting on. So I'm excited to share some of this with you today. And today, this topic is called Decoding the Language of Healthcare so you can stop feeling like you are the problem. Now, I came up with this topic because I was talking to a client on my table last week, and she was so frustrated with the care that her husband was getting in healthcare. And, I heard her frustration and I wanted to be able to help her. So I explained all of this to her in a way that she understood so that she could see that what she's reading in her husband's report doesn't reflect the fact that her husband isn't doing the work he was told to do. It reflects a conversation between the provider and the insurance company. And I'm going to take that conversation and break it down for you so that you know what you're up against. And I hope this helps, guys. Now, I spent over 20 years working inside physical therapy in the healthcare system, and I watched it up close. We were taught to document things about patients in a way that the patient would probably never understood if they read their own chart. And I watched many patients feel confused, dismissed, and blamed for outcomes that had nothing to do with them at all. And today, I'm going to decode some of that language for you. And guys, if you're a provider, this podcast is not meant to criticize what you do, because you have to write it in a way for insurance to cover. But I really am speaking to the customer here to help them understand that, this language does not mean that they are crazy. It's not meant to dismiss them. It's simply so that the health care treatment that they are receiving can be reimbursed by the insurance company. And guys, I have to tell you, I have worked with some darn good providers my entire career. And now I'm outside that system, but I do call on those providers a lot because they are just super smart in what they do in reactive care. And I do talk a lot about reactive care, but that's, again, not in a negative way. It's only meant to help you understand the difference in reactive care and proactive care, because it's your choice what you decide to do. And all of our systems are built around each other. My model of care is actually in between healthcare and fitness. It's that gap that is exposed, and that's where I fall in between. I'm just one part in a wagon wheel, is what I tell most people. But I do want to help you understand that when you read your medical record, or when your provider says something that makes you feel like you did something wrong, or that your experience is not being believed, that language is not at all about you. It's about a system. It's about reimbursement. And once you understand that system, the language, it just doesn't feel so personal, okay? So all of us are anxious about getting our healthcare documentation and see what our doctor says about us. All of us care way too much about what a doctor tells us. Healthcare documentation language is built for insurance approval and for legal protection. It's not meant to communicate with you as the client. And when a provider documents something in your chart that feels offensive or inaccurate, it is almost always clinical shorthand for a billing or an outcome category. It's not a personal judgment at all. Most patients never see their own records, and when they do, they're reading a language that you're never taught. We had to go to school to learn this language, and today I want to teach you about that language. Now, This is how the healthcare system actually works. Before we get into the actual specific words, I want to break down specific terms, and I want you to understand the environment those terms live in, because when you understand why providers write the way they write, well, it all just makes more sense. And I worked in physical therapy as a physical therapist assistant for over 20 years. And I owned my own physical therapy practice for 7 or 8 years before I walked away completely to do stretch mobility coaching. And I saw what paperwork looked like from inside the system. And I had to write the documents, as did my physical therapist, as did my physical therapist assistants, because that's how we got reimbursed for your treatment. It was not really built around your experience. It was built around a diagnosis code and an insurance approval. Now, here's how a healthcare visit typically works. You come in with a pain or a problem, and that is your personal experience. And your provider performs a clinical evaluation. That is their assessment of your body against a set of standardized tests. Now, the provider is going to establish goals, and those goals have to be tied to what your insurance company will approve and pay for. Every note written after every treatment or visit has to justify why the insurance company has to cover that treatment. And many of you are going to hear the language, if the treatment was medically necessary. And that is your justification that it's written in clinical language, not in human language, okay? Medically necessary doesn't mean that you don't have a problem if it's not medically necessary. Your chart is not a record of how you feel. It's a record of what the provider can prove to an insurance company so that they get reimbursed for payment. Now, that gap between how you feel and what can be proven is where most of the confusion and hurt happens. You go in feeling something real, a pain, a problem. The provider cannot document what they cannot measure. And when what you feel does not match what the test shows, that is when the language in your chart starts to feel like it's calling you a liar. And it's not. It is documenting a gap between your subjective experience and the objective testing. And those are two different things, and both can be true at the same time. Now let's talk about these terms, what they write and what those terms actually mean. I'm just going to do a few just to kind of help you get the idea. And I've chosen 5 of the terms right now. And for each one, I'm going to tell you what the provider wrote, what they actually meant, and how it probably made you feel, and what the truth of that language is. Are you ready? The number one that I heard all the time in physical therapy, and I had to document it: patient is non-compliant with their home exercise program. Now, your provider, your physical therapist, your chiropractor is going to write HEP, which stands for home exercise program. The documentation states the patient did not perform or did not report performing the prescribed exercises at home. And here's what that means. The procedure the provider established did not work for you. You performed the exercise, it didn't feel like it was working. In insurance documentation, non-compliance is one of the categories used to explain why progress was not made. So it shifts the documented reason for lack of improvement from the treatment protocol to a patient behavior. You choose not to do an exercise because it's not working. Your provider says they're non-compliant with the exercises I prescribed, and it makes you feel like you didn't do or try like you should have when you did, and it just didn't work. Now, the truth is, non-compliant doesn't mean you didn't do the work. It's a documentation term that covers any situation where the expected outcome was not reached. And in many cases, it means the treatment approach did not address the actual source of the problem. It doesn't mean you didn't do something. The provider is simply saying the home exercise program didn't work for you. The system needed a reason for the chart, and this was the category that was available. And here's another one. Patient claims not to feel well, but I see no evidence to substantiate this. That's kind of like a big one that hits you in the heart. Here's what they write. The patient reported symptoms that are not measurable or visible in the testing tools I have available to me in a clinical setting. And what it means is the provider cannot document subjective experience, what you are experiencing, with any of their objective clinical tools to support it. And their note is not saying that you're not sick or not in pain. It's saying that the available test did not produce a measurable result that matches what you're saying. Without that measurable result, insurance will not approve or continue payment for certain treatments. It's going to make you feel like you're dismissed. You're going to feel like the provider is saying your experience is not real, and you feel like you're being called dramatic or a hypochondriac. And this language can feel deeply dehumanizing, especially when what you are feeling is significant and it is affecting your daily life. The truth is, guys, what you're feeling is completely real. There is just no testing that equals what you're feeling. And that's not a bad thing. It means the tools available to the provider in that system did not find anything that a treatment would help you with. Your condition is real, okay? Especially when we're talking about movement, joint decline, and early stage mobility loss. It is totally real, but none of these appear on a standard imaging or a test until they have progressed to the point of damage. This is exactly the gap that I work in. And here's another one. No clinical evidence to support this. Now they're going to write, the provider performed the available standardized clinical test and the results did not produce measurements that meet the threshold required to document or code a specific diagnosis. Here's what it means. The condition that you are experiencing does not yet meet the criteria the insurance system uses to classify and approve treatment for that condition. This doesn't mean nothing is wrong. It means that the wrong has not yet reached the level the system is designed to detect and treat. This feels like you just went to the doctor for nothing. You feel like you're wasting your time and you're spinning your wheels and you're wasting money. You feel like the system confirmed that you are fine when you know that you're not fine, and this language can make you feel invisible. And here's the truth. Healthcare is built to detect dysfunctions, conditions, problems that have already progressed to the point of visible damage or measurable pathology. It is not built to detect decline or something in the process. The progressive loss of joint mobility and muscle function that precedes the damage. No clinical evidence to support this often means you are in the gap between healthy and diagnosed. And that gap is real. That gap is where I test. And that gap, guys, that means you can do something about it. Now, the fourth term, patient appears to. So the provider is going to document an observation that is based on their visual or behavioral assessment of you during the visit. This is a clinical observation note. This is not a diagnostic finding. And what it means is that patient appears to is used when the provider cannot make a definitive clinical statement but needs to document something they observed. It protects them from legally and clinically framing the note as an observation rather than a fact. And this is a hedge. It's not an accusation, okay? And what this often feels like is, depending on what follows the word appears to in this phrase, it can feel condescending, dismissive, and judgmental. Patient appears to be exaggerating. Patient appears to be in less distress than reported. Patient appears to understand the diagnosis. Each one of these are going to be felt differently, but all of these create distance between what you are fully experiencing and how it's been documented. And the truth is, this patient appears to is documenting language for I observed, but I cannot confirm. Okay. It means the provider is protecting themselves in a system that requires them to state something. It's not them deciding what is real for you. It's them documenting at the limit of what they can clinically prove. Now, the last one is, I believe the patient does not know what normal feels like. And this was what my client was talking about. This was what was written in her husband's documentation of his testing, which they found nothing, but he still knows something is going on. It just hasn't appeared on any clinical test. Now, here's what they write. The provider is documenting a clinical opinion that the patient's baseline perception of normal has been altered. Typically, this means that the patient may have adapted to a chronic condition to the point where abnormal has become their new normal. Here's what it means. In clinical context, this note is attempting to explain why the patient's self-report doesn't match the objective findings. It can be used when a patient reports extreme symptoms that do not align with any clinical picture, or when a patient does not recognize that what they are experiencing is not actually their baseline. It's going to feel like this is one of the most painful things a patient can read in their own chart. It sounds like the provider is saying, you don't know what you're talking about, or you don't even know your own body. It sounds condescending, it sounds dismissive, and it sounds like the provider has decided they understand your experience better than you do. And for the patient, this language can feel like a violation of trust. Here's the truth. When a provider writes this, they are almost always documenting a clinical discrepancy. A situation where what you report and what the tests show are significantly different from each other. And they may be right they may be right that your baseline has shifted and you have adapted to a state of decline that has become your new normal. In fact, that is often exactly what is happening when we're talking about movement health and joint decline and muscle decline. But the way this documentation makes you feel, it makes you feel like you don't even know your own experience. You know how you feel. The system does not always have the tools to confirm that. Now, this is why this language exists and what it is protecting. I want you to understand that this has nothing to do with you personally. And I'm not here to tear down the providers who use this language, because I trained inside the system and I too had to write this stuff down. The people I work with were genuinely trying to help their patients, but they are provided a care and education in reactive care, and they provide treatments. And in order to provide you with a treatment, it has to be medically necessary. But the documentation system they work inside is not built around your experience personally. It's built around insurance approval, codes, legal protection, and diagnostic thresholds. And when those two things are mismatched, you feel like your experience is negative. Guys, this language is literally existing just so that your insurance company will actually cover your procedure, and they're trying to find every way that they can to get that treatment covered. Now, here's what the system is actually built to protect. It's built to protect insurance approval so that the provider gets paid. Every note has to justify to a payer, your insurance company, that treatment is medically necessary and that the diagnosis code supports the treatment being billed. It's also built to protect legal protection, to protect providers through observations and clinical findings in a precise language to protect them against liability. The more precise and hedged the language, the more protected the provider is. Now, there is also a diagnostic threshold. The healthcare system is built to treat dysfunction and diagnoses, conditions that have already produced measurable damage. Our diagnoses and our diagnosing systems in our healthcare system will not detect joint decline and muscle decline. And this is the progressive loss that precedes any damage that leads to pain, that leads you down a path you don't want to be on. Now, it's actually also built to protect outcome accountability. When treatment does not work, the documentation system needs a category to explain why it didn't work. And that category often makes you feel like you did something wrong, but it all is to make sure that there is a way to document an outcome. Something happened to you that improved your problem and produced an outcome. None of this means your provider doesn't care. Providers are amazing. They are working inside a system that was not designed to measure what is actually happening in your body before it becomes a diagnosis, okay? And until someone builds a system that measures things before that, then you're going to be going back asking for answers that your provider is not going to be able to give you because they don't have testing to be able to show a diagnosis. And this is what this means right now. It's actually good news, okay? And here's what I want you to take away from today's podcast. When you read something in your medical record and maybe it offends you or it confuses you or makes you feel like you were not believed, just know that this is just them documenting what they saw if it relates to their clinical testing, and it produces proof of medical necessity so that your insurance company will pay for the treatment. Now, let's break down undetected and untreatable, okay? Because I want you to know that difference. Healthcare detects dysfunction, conditions visible on imaging, measurable in blood work, or diagnosable through standardized testing. What healthcare does not detect is joint decline and muscle decline. And this progressive loss of joint mobility and muscle function that precedes the imaging finding and the diagnosis. And that's because when you have joint decline or you have muscle decline or muscle wasting or you're losing muscle mass, those are not detectable because they don't meet the standardized testing of a diagnosis. So when we're talking about a muscle, you must be diagnosable for sarcopenia before they're going to say you have a muscle decline or a muscle diagnosis, unless you have other muscle diagnoses that are actually diagnoses that are progressive and degenerative and neuro-related. When your chart says no clinical evidence, it doesn't mean that you are healthy. It means your decline has not yet crossed the threshold the system can detect. And it means they can't treat you because it's not medically necessary. And when we're talking about a threshold that a diagnosis is delivered, that means there is damage. It means you have to be bone on bone, or you have to have arthritis. You have to have a tear. You have to have arthritic change visible on an x-ray, okay? But guys, when we're talking about the movement system and movement decline, you're not going to see decline on any of these testing. And if you put it off, it will become arthritic, or it will become bone on bone, or it will become a tear. But waiting for your insurance to pay for it because it's visible is like, just accepting the fact that you're like, well, I'm not going to pay to prevent this. I'm just going to let it keep going because then my insurance will pay for it. And guys, you're in a whole different cycle when you do that. You do not have to wait until you reach a threshold to address what is happening in your body right now. That is why I built the Mobility Health Score. It was built for you, not to replace the healthcare system, not to diagnose any disease, but to test your joint and muscle decline that happens before you have a diagnosis. It also measures joint mobility loss before it becomes any joint damage. And it gives you a number and a movement age that tells you exactly where your body is in this process right now, while there is still time to reverse it. Now, here's why reactive care feels like it's working for you. Okay, let's say you do have pain and you've been battling with pain for 3, 4, 5 years. Most of your providers are going to provide treatment. They're going to provide stretching, range of motion, massage, soft tissue work. A great PT session can make you feel stronger than you have in months. And a chiro adjustment can relieve pressure that you've been carrying on for weeks. And I'm not here to tell you those things are wrong. They are great treatments, okay? We have some pretty awesome chiros and PTs, and what they do and the work they do to help you once you do have pain, because it sneaks up on you, they're just miraculous. But there is research that confirms that they reduce pain and improve symptoms. And I've seen it in myself. What I want you to see is that treatments are giving you sort of a temporary fix. Okay. And here's what they're not doing, because that's the difference in feeling like you're in control and actually being in control. Reactive care, here's what it's actually doing in your body. When a muscle is tight, then the reactive care system is going to stretch your muscle and you're going to create temporary circulation, reduce tension in that muscle. It's going to feel really good. And that's a real feeling. When a trainer or a PT activates a poorly functioning muscle and loads it with resistance work, it's going to create a neurological response that increases its output temporarily, and you're going to feel stronger. That is a real feeling. When a chiropractor adjusts a restricted spinal segment, it feels amazing. And massage therapist releases a tight muscle, it just feels great. And it reduces your pain immediately. Those are real feelings. You've got dry needling, manual therapy, foam rolling, and mobility work all have documented evidence that symptoms improve with their use. None of this is false. Every one of these approaches work, but they're not meant to work and reverse. The word fix and treatment is temporary. It doesn't mean you're healed for life, okay? And most of us just have this preconception that, hey, if we get one thing and we finish physical therapy, we're done for life. And guys, it just doesn't work in, because our body, we are still aging. Some of us, our cells are changing. We are getting older, we're getting injured, degeneration is creeping in. Every one of the treatment approaches work for what they're supposed to work for. Every one of them is treating a muscle that is tight or weak because a joint has already gone into decline. Here's the part I want you to take away from this. The muscle you are stretching is tight because the joint above it or below it has lost its end-range mobility, and your nervous system has turned that muscle into a stabilizer that it's not supposed to be. The muscle you're strengthening is weak because the nervous system has inhibited it through arthrogenic muscle inhibition, and it is a neurological response to joint capsule restriction. You can stretch that muscle every day for a year and it's going to come back tight every time. You can strengthen it through every program your trainer designs and it will continue to underperform because the joint driving the inhibition has not been addressed. And when you have lost the function of your muscle and it has gone through an atrophic phase, then you've lost muscle fiber. So that strength, it used to be easy to gain. It's no longer easy to gain. And here's how reactive care creates dependence. When you get a massage and it relieves your tightness and 2 days later the tightness returns, you book another massage. The relief is real, but the source is unchanged. When a PT reduces your pain during the treatment period and the pain returns weeks after you are discharged, you return for another round. The treatment worked, but the joint decline drives the pain and it was never measured or restored. And when chiropractic adjustments give you relief and you need to return every few weeks to maintain that relief, the adjustment is reaching the symptom, but not the system beneath it. A personal trainer is going to make you feel strong, but you still have the same chronic tightness after years of consistent work. The training is building on top of compensating patterns that have not been corrected. Now, all of these treatments are wonderful, okay? And you need these treatments. They are successful, they're measurable, and they are going to give you relief. But all of these treatments are still missing a main component. And the cycle underneath that, which I talked about in last week's show, it's called the silent shutdown cycle. You are just treating the symptoms of that cycle. You develop symptoms, you have tightness, pain, stiffness, and weakness. You seek treatments and the symptoms improve. Return to normal activity, joint decline and muscle decline continues. We have it. It's in research, guys. Muscle mass loss is measured at approximately 8% every year before age 60. It accelerates after that. If we address that muscle loss by improving the health and function of the muscle. And if we regain that end range motion, where are we going to be 10 years from now? I predict we're not going to be in the same situation that we're in right now, because hopefully the surgeries are going down. We are seeing it in our clinic. We just want to be able to, train providers as stretch mobility coaches, so we have more of them around the US to be able to help you guys avoid surgery altogether. Now, when you have a symptom and you seek treatment, that's great. Get your insurance to pay whatever it can pay for when you're in that. But when you're done with it, it doesn't mean you're done. Come see a stretch mobility coach. And if you have symptoms, but they don't show up on a diagnosis or a diagnostic tool, that doesn't mean nothing is wrong. It means you need to see a stretch mobility coach. Now, we're sort of that in between healthcare and in between fitness. And our lane is the movement system to identify and control that system. And we focus on joint end range mobility and turning on those deep muscles so they stay on. You still need to strengthen, or you're still going to need a PT until your symptoms are gone and completely gone. But you have to put in the work to do that, because they don't just go away because you do PT and do stretch mobility coaching. You have to get to what's going on. And what's against you is the fact that you are aging and disease and injuries. Eventually, decline crosses a threshold into a diagnosable condition. At that time, your insurance is going to pay for it. Before that time, your insurance is not going to pay for it. Now, let's talk about control and what it actually looks like. To gain control of the silent decline cycle, you're going to need to get to know your mobility health score. Know exactly where your joints are in decline right now and your muscles, and don't wait for the symptoms to turn into pain. Full control means restoring the joint capsule in range so the nervous system stops driving the inhibition and the compensation. So the muscles that your trainer is working on can actually function the way they're designed to function, and you build strength and mass. Full control means your massage lasts longer because the system driving the tightness has been addressed. That your PT results hold because the joint restriction that was limiting the muscle has been restored. And your training produces results that last because you're no longer building on a compensating pattern. Full control means that when your chiropractor is doing your adjustments and they're working to keep your nervous system healthy, it means that you see a stretch mobility coach to maintain all of the joints in your body and the muscle health, so that when you go get your adjustment, it does hold. So that when they give you a stretch, then that is something you can do in the meantime until we reverse and get that joint decline and muscle decline back into where you can preserve it, okay? Reactive care and stretch mobility coaching, we're not in opposition. Stretch mobility coaching is in the middle. And when the joint is restored, reactive care works better and it lasts longer because the foundation has been addressed. You're not addicted to treatment because you are weak or because the treatments are bad, okay? You are returning to treatment because the source has never been addressed. The moment the source is addressed, the frequency of treatment is going to drop. The relief is going to last longer. The symptoms are going to return less. And because the system driving them has been restored and it's not in a state of continual decline. Now, I want to set your expectations before you walk into a healthcare provider, because if you have had symptoms for a long time and all of a sudden you start feeling pain, I want you to have your expectations to meet what the provider's actually able to do. This is actually something I wish people had told me 20 years ago when I was working inside the system and watching patients leave feeling they had not been heard. This happened to my mom. It's happened to my children. It's happened to me. And here it is. Your provider is not looking at everything you are bringing in that room. They are looking at exactly what they need to look at to do their job. Guys, this is a boundary. And when you understand where that boundary is, you stop expecting them to cross it and provide you with something that they can't provide you with. Every provider out there wants you to be healed. They want you to live your best life, but they can only do what they've been trained to do. Your primary care doctor is there to rule out disease and to refer you to the right specialist. That's their job. They are not there to assess your joint mobility decline or your movement age. Your orthopedic surgeon is there to assess structural damage and determine if surgery is indicated. They are looking at what is broken, not looking at what is declining, okay? They have no idea because they don't even know that stretch mobility coaching exists. So when you go back and say, I'm seeing a stretch mobility coach, they're going to say, keep doing what you're doing if you're getting the results. Or they're going to say, I'll see you next year because arthritis isn't going to stop, because they assume you have no way of controlling your decline. Your PT, they're there to treat a diagnosis that was referred to them within the number of visits the insurance will approve. And they are working inside a box that is drawn way before you walked in the door. Your chiropractor is there to assess and adjust spinal alignment. That is their scope. They are not trained to test in-range joint mobility loss across every joint in your body. They only have a few minutes. You want to get your adjustment and get out of there. A stretch mobility coach is going to test, and we're trained in range joint mobility, but we're going to spend a lot more hands-on time with you in doing that. Now, every single one of these providers are doing exactly the job they were trained and licensed and paid to do. That job is not the same as the job you are hoping they will fill. This mismatch happens when you walk in wanting to be fully understood and fully tested and fully restored. And they walk in looking for a diagnosis code they can treat inside a 30-minute appointment that an insurance company is supposed to reimburse. Both of you are doing exactly what you think you're supposed to be doing, but you are doing different things. And nobody told you before you got in there. So I hope you found this helpful. Here's what you're bringing in that they're not equipped to address. You're bringing in the full experience of how your body feels, all of it. The tightness in the morning, the stiffness after sitting, the things you've stopped doing, and the fear that it's getting worse. You're bringing in years of accumulated decline that has not yet crossed the threshold of a diagnosable condition. And that is good news. That means come see a stretch mobility coach. You are bringing in the hope that someone will finally connect all of it and give you a complete picture. You want answers. Your provider is not equipped to receive all of that, not because they don't care, but because their job description does not include it and their system does not have a billing code for it. They are allowed to spend 10 minutes with you, and that is it. That's because that is all they can bill out to get paid for, and they've got to go to the next person. The healthcare profession is a business. So here's how to walk into any provider visit differently from now on. Know what they are there to do. Let them do that job. Do not measure the success of that visit by whether they understood everything you brought in. Measure it by whether they did a specific job they were trained to do. And then come to me for the part they're not equipped to do. I will test your decline. I will listen to you. I will measure your joint mobility. I will give you the numbers. I will help you feel and understand what is going on in your body as it relates to movement. And then I'm going to give you your movement age. I'm going to give you a plan that addresses the system before the system fails. That's not their job. That is now my job. Now, I want you to book an Unlock Healthy Joint Mobility session. Come in and get your mobility health score. Get your movement age. Find out what is actually happening in your body right now before the system has a name for it. You do not have to wait for the damage to get answers. The answers are available to you right now, and they start first with joint mobility testing. I can't wait to see you in the office. I hope that you found this information helpful. If you want some information or a quick reference on this language, then just reach out to us at support@thestretchmobilitycoach.com. We can get that information over to you. The things that they write down are not a depiction of what you're experiencing. They are just stating what will be covered by insurance and making sure that they have a test to provide you with a result that then that result they can perform treatment on. Way before you get into the healthcare system, you're able to see a stretch mobility coach. You can actually see a stretch mobility coach when you are seeing a healthcare provider, but you're going to be seeing a stretch mobility coach for things that you're not being under medical care for, because we want to make sure we follow the doctor's orders and that we're keeping your entire body and joints and muscles healthy while you're going in to PT and getting your shoulder worked on. So let's have your shoulder be worked on by the PT, and let's stretch mobility coach work the rest of your body. Let's have the chiropractor adjust your spine and your other joints to protect your nervous system and allow them to give you what they give you to help keep your symptoms at bay. Allow the massage therapist to massage your muscles and to keep them healthy. And go to yoga, walk, run, work out, do the things that you want to do, and make sure that when you do it, you feel amazing. Thanks so much for joining the show today. I appreciate you, and I will see you next week.